Division Director with. Oh, good call, Donda.
No problem. Started with that one.
It's like, Ryan, hold up. So I'm Ryan Templeton, Policy and External Affairs Division Director with the Behavioral Health Administration. Part of my role, or kind of a dual role between myself and Intergovernmental and Community Engagement Division Director Megan Shelton, who I don't think is able to make it today, is to administer the Behavioral Health Planning and Advisory Council, not to be confused with the Behavioral Health Administration Advisory Council, which is another advisory council with similar roles and responsibilities, but the authority of where those come from are very different. This is the planning council. This planning council Bhpac is what we refer to, comes from federal statute. So that requires states, in order to receive the federal mental health block grant, community mental health block grant, need to make sure that we have an active planning council in order to receive those dollars in for the state of Colorado. So that is this. So a clear one. Feds require this. We appreciate that a lot of new faces here, which I think shows the excitement of we're in a good spot with behavioral health and really trying to move to a spot where really improving what access to and quality of behavioral, or of really affordable behavioral health services. That's really the foundational goal of what the Behavioral Health Administration was created for, to really drive home the quality and access to behavioral health services. I mean, I think we can probably all agree we got some work to do, but I think groups like this can really drive home the what do we need here, because you all have massive amounts of knowledge and experience and really good ideas. So really lean into that. So thank you for your participation today. With that, Donda. We missed Donda last month. So.
All right. Let's go ahead and start with introductions. Laureen Gilroy.
I'm Laureen Gilroy. I'm with the now called Rocky Mountain Clubhouse Coalition. And this is a group of clubhouses. Clubhouses are kind of in recovery, I think. It's hard to define what these clubhouses are, and it's hard to fit them into a section, whether it's treatment, prevention, etc. But I view it as prevention only because if you go to the clubhouse, you're more likely to not need to go to the hospital. So that seems like prevention to me. Anyway, that's the story. I'm from Greeley. Well, that's where I hang out.
Thank you, Laureen. Dennis Streeter.
I'm Dennis Streeter, and I am recently appointed as the co-chair of membership, and I'm also on the prevention committee, where I have a lot of passion. I am a lived experience with as a primary caregiver for my wife with dementia, and also created our community broadcasting network to produce and put online information for the greater community about behavioral health issues, as well as diversity, equity, and inclusion.
Thank you, Dennis. Lloyd Moore.
Good morning. My name is Lloyd Moore. I'm a person in long-term recovery. I'm your outgoing membership co-chair. I'm also, along with another person here, I am no longer officially a member of council, but I'm here as a guest to continue to try to assist all of the new folks going into these positions along. Thanks.
And we truly appreciate that too, Lloyd. Sharon Mausch, please introduce yourself.
I'm Sharon Mock, and I work for the Collaborative Management Program as a family advocate. I also do Circle of Parents and Circle of Parents in Recovery. I also joined the Family Voice and Choice committee for the state. What else do I do? I do a lot of things. I'm a person with lived experience. I taught school for a lot of years. I've been involved with people with all kinds of behavioral issues, and I just bring a lot to the table, I think, because I've been involved in so many different things. And I'm also working with several state committees. I work with in our development of the hub, and just wherever I can be involved, because families are very important to me.
Thank you, Sharon. Sean Gartrell, sorry.
Good morning, everybody. My name is Sean Gartrell. I'm a person in long-term recovery from substances and also living in wellness from mental health issues. I'm the director of training at Advocates for Recovery Colorado out of Denver. Thanks.
Thank you. Megan Lovelace.
Hello, my name is Megan Lovelace. My pronouns are they, them. I'm the mental health policy lead for the Colorado Cross Disability Coalition. I also sit on the Child and Youth Standard Service Advisory Board. I think I said that right. And I sit on the MEAC and the PIAC for Ray 1. I am a parent of a fabulous young lady who has complex needs, and I'm really happy to join y'all today. Thank you.
Thank you, Megan. I promise one of these days I'll get your guys' names right. Erin, go ahead.
Hi, everyone. I'm Erin Black, and I live in Loveland, and I've been in Larimer County for over 25 years. Our family has lived experience with not only mental health issues, but drug addiction issues and maneuvering the education system and the criminal justice system. My oldest is 27, and he had his first psychotic break when he was 14. So we have been down a long and winding road. I have been a advocate, volunteer, and educator with NAMI. I have served on our county's largest behavioral health services provider, Summit Stone Health Partners, for about 6-7 years now. And I'm currently running for city council in Loveland so that I can make this a higher priority in our city. And I'm very happy to be here. Thanks so much.
Thanks, Erin. Susan Wagner.
Sorry, couldn't unmute there for a second. I'm Susan Wagner. I'm the manager of peer services at Jefferson Center for Mental Health. We cover Jefferson County, Gilpin, and Clear Creek County. I have been a peer specialist for over 16 years and in recovery from mental health issues for over 30 years. And I'm excited to be here.
Thank you, Susan. Candace.
Good morning, everybody. My name is Candace Ludwig. I am a woman living in active and sustained recovery, and I'm here as part of the recovery committee.
Thank you, Candace. Margie.
Margie Grimsley, and as Lloyd said, I'm no longer on the council because my term was up last month, but I also am here to remain on the prevention and the membership committee. And I'm glad to see we have new family voice people at our table. And I'm with the Colorado Federation of Families for Children's Mental Health. Thanks.
Thanks, Margie. And let's go with Carrie Eckert.
Good morning. It's actually Kari Eckert.
Sorry, Kari.
No, I get that a lot. I'm in Lakewood, she, her. I'm the executive director of Robbie's Hope. We're a youth-based youth suicide prevention organization.
Thank you and welcome. Jules Rosen.
Hi, my name is Jules Rosen. I'm new to the committee, I spent 32 years at the University of Pittsburgh as professor in the medical school and business school and chief of geriatric psychiatry. And then I came out to Colorado and entered community mental health, which was a huge surprise for me. While working with this organization, we developed techniques that have reduced wait time, achieved immediate access and engagement, and won 2 national awards. We're now trying to distribute this across the country and hoping to introduce this to Colorado. And I will jump off now and I'll be back.
Thank you, Jules. Angie Wold.
Hi, I'm Angie Wold. I'm the Director of Operations for Addiction Research and Treatment Services, also known as ARPS. And I think that my term is probably up, but I still enjoy coming, so I will just keep attending as a guest.
Thank you, Angie. Amy Leiden.
Good morning. I'm Amy Leiden. I am the clinical coordinator of peer services with Jefferson Center. So I work alongside Susan Wagner. I've been a peer specialist for about 12 years. I also have my master's in social work, so I do a little bit of clinical work as well. And I have my own lived experience. I've been in long-term recovery. I'm a suicide attempt survivor, and that really plays into everything that I do. I also handle the grassroots advocacy efforts for Jefferson Center, which is kind of unique for a community mental health center, but an important part of what we do in elevating voices. So yeah, I hope to, this is my first meeting, and I hope to bring a lot to this table with a variety of different perspectives.
Thank you. Jacob Fry.
Good morning, everybody. Jacob Fry, Director of Operations with Sobriety House. Happy to be here this morning.
Thank you, Jacob. Christy Elliott.
Good morning, everybody. My name is Christy Elliott, and I am here on behalf of Phyllis Reed with the Colorado Department of Education. I work in the Health Education Services team within the Student Pathways Unit, and we have many mental and behavioral health grants that service schools, staff, and families in all across the state of Colorado, and I'm happy to be here today.
Thank you, Christy. Laura Dykes. Just as you took a drink.
Morning, everybody. I'm Laura Dykes with Colorado Coalition for the Homeless. I'm the LCSW, the Behavioral Health Quality Assurance Director there. I am here as a non-voting member, serving for many years prior to this until I can try to find a replacement for me. And it's so awesome to see so many fresh faces. Someone has been recruiting big time, so it's great to see so many people.
Thank you, Laura. Michael Miller.
Hi, everybody. Michael Miller, he, him pronouns. I am the interim supervisor for the Points West Syringe Service Program in Jefferson County. I'm in recovery and also a user of banned drugs. Not quite sure about my status as a member, so I'm likely here as a guest, but hoping to kind of re-engage with this collaboration. Thanks for having me.
Thank you, Michael. Aaliyah.
Hey everybody, Aaliyah Andrews, she, her pronouns. I am the Recovery Services Manager at the Behavioral Health Administration.
Thank you, Aaliyah. Let's go ahead and Lou Johnson. Oh. Did we get you, Lou?
There we go. My name's Lou Johnson. I'm new to the group. Joined last month. I'm a person in recovery and sober living.
Thank you, Lou. Alicia Lancome. Emil.
Good morning, everyone. My name is Alicia Lacombe. I'm actually a guest. I'll put my camera in. I think this is my first time participating, so I'm a guest, but I do work in the field of ECE as a trainer and a coach, and I also sit on the board of COHEM. And thank you for having me.
Thank you. Kristen Toombs. Kristen, are you there?
Sorry about that. I'm on my phone and I'm having a hard time finding the mute while looking at everybody. So sorry.
No problem.
Good morning, everybody. I'm Kristen Toombs, she, her, hers. I am with the state. I'm the director of our Office of Homeless Initiatives. So here to support with that of the intersection of behavioral health and housing stability. So glad to be here with you all.
Thank you, Kristen. Bonnie Holiday.
Good morning, all. My name is Bonnie Holiday. I use she, her pronouns, and I'm a program manager at the Colorado Department of Public Health and Environment. I'm in the Prevention Services Division, and I'm here to provide any prevention-related technical assistance, support, or resources. And I apologize, my internet's very unstable today, so I might be off camera for a bit, but I'm still here.
Thank you, Bonnie. Charles Davis.
Thanks, Donda. I'm Charles Davis, CEO at Crossroads Turning Points. We have services throughout Southern Colorado. We do treatment, prevention, as well as recovery. And we'll be celebrating my 32nd year here on Friday. And this is my second tour of duty with Bhpac. I served 6 years back in, I think, 2010 to 2016. And just excited that the field has really progressed over my career, and that we're giving a lot of people voice and treatment that in the past weren't able to access treatment. So just excited to be a part of it. Thanks.
Thank you. Lori Banks. There we go.
I knew I was muted. I just had to get off of it. So good morning. I'm Lori Banks, and I'm the Chief Administrative Officer for Aurora Mental Health and Recovery. And I apologize for being late, but I have a meeting that's just before this one.
Thank you, Lori. Chris, how do I say your last name? Matoush?
Close. Chris Matoush. Okay. I'm with Rocky Mountain Health Plans, and I oversee crisis services for Region 1. I'm here as a guest and appreciate the invite.
Thank you, Chris. And Stephanie Johnson.
Good morning. Apologies also for needing to be off camera for just the first few minutes here. I am the Director of Community Relations and Public Policy with WellPower in Denver.
Thank you, Stephanie. And Carla joined us. Carla Sloranzo? How close?
Yeah, thank you. I was joining in late. I was having technical difficulties. My name is Carla. I'm from Mission Possible. I'm a wraparound facilitator. This is my first meeting, so thank you for having me.
Thank you. And is there anyone we missed? I think that's everybody. Did I miss anyone? Wonderful. Well, thank you all. My name is Donda Gorton. I am the Office Administrator for Behavioral Health Administration, and I'm your administrative guide for all of this. And then Mr. Templeton, all yours.
Yeah, fantastic group. Thanks for everyone joining. Yes, someone has been recruiting big time. So thank you. I'm assuming that's the membership committee, which will be a heavy topic for today. I do want to start out with some pieces. We got we'll say a response from our federal partners, the Substance Abuse and Mental Health Services Administration. That's who we submit our block grant plan to, and they come back with questions related to our plan, as well as they had some specific questions about our organization here at Bhpac. Specifically, apparently there's a new requirement that we are required to have the state Medicaid agency, which is in Colorado, the Healthcare Policy and Financing, included in our membership roster for Bhpac, which I think is a good thing. I think we've had that conversation before, is even though it's not federally required, it's strongly recommended. And now they're saying that it's a new requirement through SAMHSA to ensure that we have a healthcare policy and Department of Healthcare Policy and Finance member on Bhpac. I will do some personal recruiting with my peers over at HICPUF is the fun term for healthcare policy and financing, to get one of their behavioral health specifics staff appointed, or at least recommended for appointment over here. What we talked about last month was going through a whole cleanup process for what appointments look like to council, and getting back to the appointments come from the now the commissioner of the Behavioral Health Administration. So making sure that we go down that process of a formal appointment. So every new member gets their formal appointment, clarification on what seat you represent, with the full acknowledgement that, right, a lot of us could probably represent a whole bunch of different seats, but we want to make sure that when we send the roster list over to our federal partners, that it is clear for them about we are meeting the federal requirements for what membership looks like. But I also want to acknowledge that, yes, everyone should come to this meeting with their full experience, and able to, it isn't just the, hey, Ryan, you work for the Behavioral Health Administration, so you only represent the Behavioral Health Administration. Right. I also have lived experience as well. So yeah, I mean, I think this is an opportunity for us to really come together and really think and drive behavioral health service delivery based on the experiences that we all have. So with that kind of agenda today, really a lot about membership, a lot about planning and getting to that spot where how do we move forward with the Behavioral Health Planning and Advisory Council moving forward over these next year and a half while we work towards some potential transition times within this council as well as the behavioral health system as a whole. So with that, Donda, are we potentially ready to transition to the pretty robust membership conversation?
I'm good if you are.
Yep. Well, actually, hold up. We need chairs and vice chairs and the whole leadership structure within Bhpac. Right. I think we had previously had a conversation last month about we need to appoint a chair and a vice chair or co-chairs, at least formalize who should help us run through today's meeting, which I know we're struggling a little bit with who's a member and who's not a member and who's been termed off, and right. So I mean, obviously there's some complexity within that.
Can we, Ryan, could you define a little bit the responsibilities and such of the chairs?
Fantastic question, Maureen. I think a big part for what we need to do over these next couple weeks and months is really make sure that is clearly defined within the bylaws. We had talked through previously about updating the bylaws, and they were never formally updated or formally approved as being updated. So I think that's part of the conversation we need to have today. Today's chair would really be making sure that we get through agenda items and everyone has an opportunity to talk and have their voice be heard here. That's really what the chair should be doing, is making sure that everyone's voice is equal here. And to me, that's the core foundation of a chair, is just making sure that we're running smoothly. And the BHA and Donda, myself, as well as our state friends are 100% here to support who's ever willing to step up and wants that opportunity. Lloyd.
Let me read the excerpt of responsibilities out of the bylaws. The co-chair should be the parliamentary chair of the council. It shall be the duty of the co-chairs to preside over all meetings of the council and control the council, to supervise and control all of the business affairs of the council. The co-chair shall see that all motions or resolutions, including the recusal from vote or discussion of the council, are carried into effect. So to add to what Ryan said, basically, the co-chairs make sure that we're operating under a basic rule of Robert's Rules of Orders and guiding this council, setting the agenda, and many other things. So for those that might be interested in stepping up into a co-chair position, there's people like Ryan and others that will definitely help you come up to speed with stuff. One of the things we've tried to do over the years with co-chairs as well is to have one of the co-chairs part of our 51% of people with lived experience, whether it's a family member, substance abuse, mental health, and then or an advocate, and the other co-chair to be out of the other category, which for the new members we'll get into that deeper as we go along into trying to straighten some things out. But it's our providers would be the other co-chair, somebody from the provider pool.
Well, I'm happy to step up for this meeting. Doesn't mean I'm gonna put myself in the hat for forever, but I'm happy to move us along if so we can just move. I don't know if I have the right agenda in front of me though. Do we have an agenda for this meeting?
There was not an agenda sent out because it was going to be basically the talk about membership and then the talk about chairs. But the membership committee's doing most of the talking today. So that's going to be Lloyd and his group. Correct, Ryan?
Yep. So yeah, if we want to go down the path of a formal vote to include or have Aaron be our chair for the day.
Chair for the day.
No, I appreciate that. I mean, it's a big, like, yeah. I mean, we will 100% here to support you. I think we can all agree to that. Where it's, hey, yes, let's work through this together. And because part of what I also love is that then you don't have to listen to my voice the whole time, just talk as well.
That's great. So if someone could make that motion, that would be great.
I'll move that Aaron is the chair for the day.
I second.
Any discussion? Seeing none, I think that motion passes and we'll move along. So since we don't have an agenda, we're just kind of getting started. I'm gonna kind of pass it back over to either Ryan or Donda to see what the next step is. I guess we're trying to get a vice chair at this point. Is that correct, Ryan?
I don't think we necessarily need to today because we have you in that position. So I think Lloyd is next up with moving us through. Yeah, Lloyd has been an instrumental part of membership and recruitment, and we appreciate Lloyd's willingness to continue to help us through this transition period for members to get, and get to that spot of where do we go with membership and appointments, and then ultimately how does that get captured within bylaws so we're all working under the same authority and ensuring that we're all here working towards the same goals is really creating that cohesive, coordinated, and effective behavioral health system in Colorado. So with that, I think it is Lloyd.
Thank you.
Thanks, Ryan. All right. I think the first thing we'll do here is with membership, with the order of business, is actually have our new members introduce themselves a little bit more than what we did initially. If you would tell us which part of the state you're from, and if you're a provider, or how you apply to council. Did you apply to council as a provider, a family member, person with lived mental health experience in recovery, etc., and maybe what you what interested you in council and what you might want to see with this council, if you have any thoughts about that. So with that, this is going to kind of go in an odd order. See, Jules had to jump off, correct? So Aaron Black.
Yes, sir. And thank you, Lloyd, for being here. I greatly appreciate it. And I'm sure we have a lot to learn from you with your time here. And so again, I'm in Loveland, Colorado, which is in northern Colorado in Larimer County. I've been in this county for over 25 years. I come from the nonprofit sector. So I'm very well versed in all the social services agencies in this county and how they collaborate with our local governments and state governments, specifically for funding. I got into the behavioral health aspect because my son became very ill with mental illness when he was 14. He's now 27. And so we've had a long journey with that. So I consider myself a family member with lived experience. I myself have mental health issues. I call it circumstantial behavioral health issues because of all the stress with raising my son. But I receive treatment and I'm on medication, and that helps me maintain the stress level in my life. I feel like my interest in this council has to do with I truly want the state of Colorado to be known as a leader in providing behavioral health services, making those accessible, making those equitable. And I think one day we can say that. I truly believe that in my heart. There's too many of us that care too much in Colorado for it not to happen. And as far as what I would like to see, I look forward to learning from all of you in your professional and personal experience. And I think we all have something to offer, and I can't wait to work with all of you. Thank you.
Thank you, Aaron. Carla.
Thank you. My name is Carla, for Mission Possible wraparound facilitator. I am a community partner. This is my first meeting. I think for me, it's just being part of that support and seeing more support and resources out there. So honestly, I'm just really open to whatever this council and these meetings can provide me. I also want to be able to provide back. So that's really why I wanted to join. I'm not sure if I missed any other questions, but let me know.
Carla, where are you residing? Where are you working?
In Colorado Springs.
Okay. Thank you, Harlan. Megan Lovelace.
Hi, everyone. Megan Lovelace, and I live in Lake County. I have a child in school in Eagle County and a child in school in Summit County, and that's how you do it in rural Colorado. I consider myself to be lived experience, having a very young person whom is a 3-time suicide survivor. And we've really been through the washing machine in the state of Colorado, inpatient, outpatient, outpatient, threats of entering the criminal justice system, through the child welfare system for no other reason than I have a child with a disability. I work at the State House during legislative session on mental health policy for the Colorado Cross Disability Coalition. I also serve on the Pediatric Mental Health Institute at Children's Hospital Colorado for their Family Advisory Council. I work with several research groups around children and families with IDD. And what do I hope for? I hope for a Colorado where every human is seen as their whole person, their whole self, that they're not just identified as their disability or as their mental health illness. I want a Colorado where we can be seen and heard, that family voices are leading the conversation when it comes to young people who are struggling to receive care, that we're not criminalized, that we're not marginalized. And I have this dream, and I know it can be real, and I know we have the right players at the table, and we really do need to continue to focus on that end user, right? On the people using those services. Because those are the ones who have to show up every day. So I'm really, really, really grateful to be here. And I want to shout out to Margie, because man, did Margie help my family so much and helped me to learn about the landscape. So I'm really grateful to be here with y'all, to learn from you all, and to work together to make the dream of equitable, compassionate, dignified behavioral health care for every human in the state of Colorado become a reality. Thanks.
Thanks, Megan. Sharon.
I'm Sharon Mock, and I live in Lamar, Colorado, in Southeast Colorado, and my family advocacy is actually for 4 counties. I am an advocate for Bhpac and Cheyenne Wells and Kiowa County also. I am a person of lived experience, a family member with lived experience. My oldest sister had severe mental health issues and lived at home. So I had a lot of experience with that growing up. I was a school teacher for 30 years, and I taught in the school that had 93% poverty rate of their children. So I experienced a lot of behavioral issues and mental health issues through that experience. I was also a special education teacher for 10 of those years, and with a quickly rising rate of children with behavioral issues. When I retired, I got my family advocacy job, and I work with families in all 4 counties. I also I do all their IEP meetings with them. If they have trouble in school for any behavior issues, I'm included because I work very closely with all of our schools. I have 4 children and 17 grandchildren and 19, as of a week ago, great grandchildren. So I've had a little bit of experience with children, and I have 2, unfortunately, for them, 2 grandchildren that have struggled with addiction. So I have lived through that with them. One is recovered, one is still struggling. So that's why I do the Circle of Family in recovery, because I really want to see, addiction is not who they are. It's what they're going through. And I want to see them to be able to find who they are and be able to stand up and live their life again. And not, addiction carries a long-term effect on them if they don't have some surroundings, some help that can help them get through that and find out how to get through in a way that allows them to truly recover and not have to carry the stigma and the results of so many areas that they're cut off from help and support. And so that's why I do that part of my work. I am also I have also worked with a lot of As I said, I still do IEPs. We have a lot of issues down here with behavioral health, and also with autism, and resources down here are almost nil. We can't keep therapists down here. We can't get a lot of the help that is available throughout the state. We're too far. We're 20 miles too far for somebody. We got thought we had some answers for a family that was going through absolute hell, and nope, we're 20 miles too far. So I'm here for two reasons: because I care about people with mental health and I want to support that, but I'm also here to get connections and find out how we can get better connections in our area of the state, because we are absolutely drowning in mental health issues down there, and no, absolutely we can't. It's unbelievable how hard it is to get any help for our families. And I don't believe in just begging for help. I want help from behavioral health. I want to figure out how we can get that down there. But I'm also going to bring my supply to help behavioral health, because I don't believe in just asking, saying, demanding. I believe in help. I want to help support behavioral health, support us in Southeast Colorado.
All right, thank you, Sharon. How about Amy?
Hi, everyone. Amy Lyden. I live in Adams County and I work in Jefferson, Clear Creek, and Gilpin County. So I get around on a pretty regular basis. As far as my experience, first and foremost, I bring my lived experience. I live in recovery from a severe mental illness. My treatment experience has been pretty broad and included inpatient treatment, outpatient treatment, everything in between, partial hospital, intensive outpatient treatment. As a suicide attempt survivor, I survived 13 suicide attempts, which involved also a lot of medical care associated with that. I've been involuntarily committed and also had ECT treatments, so I have a pretty broad range of my own lived experience. I also bring that to my work as a provider. So as a peer specialist and as a clinician, and as an advocate, I bring that lived experience. I know what it's like to be on both sides of that table. And I often find myself, even within our systems, educating clinicians on like, well, that's not exactly how your client's viewing that. So I bring that to being a provider. I also have, over time, I've built a pretty extensive knowledge of our treatment programs and systems. I've been in a lot of systems, and I think, I see the gaps, and that's why I continually do the work that I do in terms of policy, and making those systems better. But I also believe we kind of need to start where we are with what we have and work from there. As a provider, I know that I do the best I can with the tools and resources that I have. And that's where the advocacy, I think, really comes in. For me, working with individuals is not big enough. We have to change the systems. I believe that all policy is mental health policy, whether it influences healthcare or housing, community infrastructure. It all relates to the wellness and well-being of our communities. So I think that's what I bring.
Thank you, Amy. How about Susan?
Hi, I'm Susan Wagner, and I could just sit here and say ditto what Amy just said. But I am the manager of peer services at Jefferson Center. I live in Denver County and I work in Jefferson, Gilpin, and Clear Creek. I have been a peer specialist for over 16 years. Started as a peer specialist and worked my way up. I feel as if I'm a pioneer in Colorado in terms of peer counseling and fighting stigma. I would say that I have a lot of the same experiences that Amy just talked about, but I also have some very strong feelings about stigma and access to services. I've worked very hard to eliminate stigma, or at least reduce it to a point where it's okay to walk into an agency and get help and get treatment. As far as access goes, it's not just access to walking in the door, but access to the appropriate services and the helpful services, and the ability to get those services without having to jump through a lot of hoops. And as far as stigma goes, I use my lived experience to reduce stigma by telling my story, by working from within the system, not just trying to work outside the system, and not saying, oh, the health center, the mental health center won't do this. I am in the mental health center and I say, hey guys, we need to do this. And a lot of times, because of my lived experience and my experience at the mental health center, I get listened to. Not all the time, but a good amount of the time. And I feel very strongly about both stigma and access. I also have my own lived experience like Amy, and I have had very many treatments, inpatient, outpatients. I am a suicide attempt survivor. I've done this for 30 years. And
Did we lose? Did
I
we
think we
lose?
lost her.
I think we did.
I think we lost her, Lloyd.
Okay. Well, if she gets reconnected, we'll go back to her. How about Lou?
Hi, my name is Lou Johnson. I'm in recovery. I've been in and out of recovery for 8 years now, and I have a mental health aspect to it. I'm also a suicide survivor. Lloyd is my sponsor. I have a service position within my home group. Yeah, I've had some great help here in Colorado. Like the others, I hate the stigma and I want to help crush it. And I figure the only way to do that is to get active and get involved and figure out, what I can do. Because like I said, I've had some great help with inpatient treatment, outpatient treatment, the rooms. I've always been welcome everywhere. But I've fallen through the cracks, and I want to help people not fall through the cracks. Help them stop falling in the river instead of just helping pull them out. Yep, I'm in sober living now, so I hope to be effective in some capacity, whatever way I can be. That's pretty much it. Thank you.
Thank you, Lou. Sean Cartel.
Yeah, my name is Sean. I'm here as a provider from Advocates for Recovery Colorado. We're a nonprofit support providing free peer recovery support services throughout Colorado communities. That's authentic peer one-on-one peer groups, providing also grassroots recovery advocacy to be a face and voice of recovery, so the voiceless do get represented when ever possible. Personally, I do have the lived experience of mental health and substance use recovery. I have been houseless. I'm a suicide survivor. I have been a consumer of the community mental health system, both voluntarily and involuntarily. And so, yeah, I'm just glad to be here and see how we can make things better in the state.
All right, thank you, Sean. And Carrie.
Hi there, it's Kari. I am the executive director of a nonprofit for youth-led suicide prevention. I am a suicide loss survivor. I lost my son to suicide 5 years ago. He's 15 years old. We are very much preventative based, and I believe prevention happens in education. In the state of Colorado, education is a very difficult thing to bring to kids in this realm. And it's so effective and so simplistic, and we're not doing it as a state. So that's really where my heart lies, because I feel if my son would have received a little bit of education in this, we could have done a lot more prevention, and I may not be sitting where I am. And I think our organization is mostly about bringing the youth's voice to the table, talking with youth versus talking at youth. We do a lot of talking to them versus talking with them. So Robbie's hope and just truly prevention, prevention, prevention.
Okay. Thank you, Kari. All right. We have a few of the people that were not able to make it to this first meeting. Their name is Alex Balderassi. I am familiar with her. I think she is going to be an excellent addition to the council. We also have Amy Jackson and Hope Hyatt. And then when Jules Rosen joins us again, so those are the four that haven't been able to introduce themselves.
I'm back, Lloyd.
You're back. Okay.
Yeah, I've been back for my meeting ended earlier.
Okay. Go for it.
Yeah, well, I've heard, wow. I'm honored to be part of this group. So I spent my career as an academician in medicine, doing research, teaching, a lot of clinical care, running the program. And what I came to realize, again, I was in geriatrics, I came to realize that when I'd go to a nursing home, and this is back in 1990, 1992, to see the residents there, none of the doctors or the nurses taking care of those patients in the nursing home read any of our research articles. And that's when I moved over to the business school, and I began looking at what is it that takes a healthcare system to really change their habits and their culture, their archaic, this is how things have to be because it's always been like this. And what it boils down to is finances. And we demonstrated how by providing good care, you actually save money. You make more money if you're the nursing home. Coming out to Colorado, and again, what I mentioned earlier, I've never been in community mental health. My goal was to test these ideas. I was with the organization Mind Springs, which has since fallen into terrible disrepair. And when I was there, it had its issues. And I got there, and the wait time to see a therapist or a psychiatrist could be 8 to 12 weeks. And that everyone's okay with that. And it wasn't just Mind Springs. I now know this is true across the country. And what I initiated there was a year-long Lean Six Sigma program to look at how do we change the culture. And long story short, we created a system called phase-based care, which gets people into treatment within a week. And I'm going to address Susan here, not just access, because people play the games of access. Here, come on in and you can see somebody, then you'll wait 3 months for treatment. Engagement is immediate. I'm going to address the peers here. This was a whole treatment team, okay? Therapists, psychiatrists, peers, case managers. Peers became the most important therapeutic tool of these clinics. And I use mathematical algorithms, and we can go over this at some point if the committee's interested, but mental health centers are overstaffed, okay? You're all gonna think I'm a liar. Mental health centers are overstaffed. Very simply, more than 50 to 60% of the psychiatry and therapy time is spent seeing stable patients. Every 2 months, every 3 months, no-show rates of 50%. What we do is we shift the resources from the stable people and have other ways to keep people well. And we shift 80% of that to the acutely ill patients. And we have data on 5, 6 different programs now that is, this is supportable. So that's what and I'm going to say one other thing, listening, and I learned this from my son, who has his own serious neurologic problems, how doctors don't listen to their patients. And my son convinced me, I would see patients and they say, oh, doc, I have to have the brand name, the generic does this, and typical doctor, I say, no, it's all the same, it's the same compound, it's FDA approved. My son sent me a book teaching me how wrong I was, okay, and what I learned from that is how people like me don't listen enough to people like you when we're treating you. So I'm very happy to be part of this organization. Thank you.
Thanks, Jules. Okay, with everyone that's been able to introduce themselves and the 3 people being Alex, Amy, Jackson, and Hope Hyatt, we have 13 new members to join us on council. And so I'd like to make a motion for us to ratify the 13 new members.
I second.
Any discussion? Seeing none? Do we vote yet? Current members vote? all
Current members and Ryan, do we have new members vote as well?
Yeah.
Well, so I think the technicality is that it's voting to formally recommend for appointment to the council, and then we will take that at the BHA as a sign to, here's the recommendation to the BHA, and we will take it and run with it and get our current interim commissioner to review those and then report back in December with ideally formal appointment letters to each of you. And then that's also the plug that all of the folks that had previously been appointed will also get you those formal appointment letters as well.
Perfect. So current council members, those, please say aye. Vote approve the motion.
Aye.
Aye.
Opposed?
Aye.
Seeing none, I think the motion passes if that's a quorum.
All right, welcome everyone.
Was there anybody that we missed during this that showed up late? I know I had a person that put something in the chat. Annette, are you there? Can you introduce yourself, Annette?
Yeah, I'm a current member. I am up here in Larimer County. I am the mother and the sister to two with serious mental illness and addiction. And I also run a homeless shelter for families experiencing homelessness in Fort Collins.
Thanks, Annette. So moving on now, Ryan, where are we at now?
I would like to propose that we have the conversation about bylaws and where we go with bylaws and the updating of bylaws. And I will throw it out there that I would love to take a shot at redrafting those with our Colorado Department of Human Services Chief Legal Officer, and then get a drafted, edited version to this group as soon as possible to review the that will have already been through the legal scrutiny from our CDHS legal team. And full disclosure, I think we're trying to go down the same path with all of our advisory councils. BHAC, the Behavioral Health Administration's Advisory Council, as well as the 2765, or the Care and Treatment of Persons with Mental Health Disorders Advisory Board, as well as the Children and Youth Mental Health Treatment Act Advisory Council, which isn't the name of the council, but trying to streamline what bylaws look like, have a sense of consistency across our advisory councils. And if you would, I would love to take that shot to get that to y'all, potentially even by the December meeting.
Fantastic. Lloyd?
Yeah, Ryan, I think that would be perfect. There's a lot of the bylaws that's more of the state side information. And the last 2 times that we did update our bylaws, the liaison from the state is the one that took the initial crack at it, brought it back to council. I do know we need to get some membership things clarified and the bylaws are cleaned up as well. So,
Aaron?
Yes, Laureen.
Oh God, what's Ryan? Okay. When we do bylaws, anybody does bylaws, it always bogs down into minutia. If at all possible, and I know Donda does a great job, if the office could get a copy of the bylaws to us after it goes through legal and everything, when it's ready for our input, then we'll have a chance to know what's coming and come up with ideas. So that's all I'm asking about this. I think it's a good idea, the path you've explained of how it's going to go.
Lorraine, I appreciate that call out. I think that's a fantastic, yes, get it to us early so then we can look, so it's not just coming to a council and be like, hey, here you go. Here's this complexity that's probably going to be pages and pages long of what feels maybe like legal mumbo jumbo in there, right? And then we can even go down the path of highlighting specific things. I also want to call out Megan, thank you so much. 2765, Title 27, Article 65 of the Colorado Revised Statutes covers involuntary mental health commitments. That's thank you for that. Hey, Ryan, you're talking too fast and explaining things that people may not know. So I appreciate the call out there, and welcome all of the, hey, Ryan, slow down, right? So do not hesitate to put things in chat, raise your hand and say, or just come off mute and say, wait, will you clarify that for me? I appreciate that, because I think it gets us all into a better spot with understanding and knowing what we're talking about. But yeah, I will take that as the task of the BHA to get the bylaws updated. Tasha, I saw that you had raised your hand as well for a second there. Just want to make sure that you had that opportunity.
Mission to do that.
It was an accident, sorry.
Oh.
I may miss.
Yep. So with that, I think this is also an opportunity for us to really think about how the upcoming meetings should take place. And I will provide a little update related to the Behavioral Health Administration, what we're working on, if that's okay with the group. And you, Aaron?
Absolutely, Ryan. Take it away.
So last month, we also talked about potentially reorganizing what each monthly BPAC meeting is organized as. So really start with a like a BHA type initiative or a state initiative that's related to behavioral health, that kind of starts the flow, and then we have a conversation related to that. So it goes from, okay, an information, then to an opportunity to discuss what that is, and then that leads to the more of, okay, what sort of additional information does BPAC need? What sort of things can come out as potentially recommendations? And then also then it gets to a flow of, okay, then what are we working on as individuals, or that we should be working on as this BPAC, and then kind of set that flow of how every meeting potentially goes that way. Is that still something that this council wants to pursue, especially with a whole host of new folks? Does that sound like a good approach to how we move forward with I think there's a lot of stuff going on both within the Behavioral Health Administration as well as state agencies related to behavioral health. So I think that would be a good approach for these next couple months, to also have an opportunity for the BHA staff to come to BPAC and say, this is what I, as say the workforce development director, am working on related to behavioral health workforce, and start those, and then have those kind of conversations, and then just kind of go month by month and really try to assign really monthly agendas, so we kind of know even for the next 6 to 8 months about what to expect, but just throwing out that for the group as well.
Does anybody have any questions or comments? Megan?
I think Bonnie was first.
Bonnie, go ahead.
Megan, you're so polite. I appreciate that. So this is Bonnie, and a reminder, I'm from the Colorado Department of Public Health and Environment. We work very closely with the BHA, especially with all things prevention. And just for new folks, I wanted to let you know, in the past, we've had CDPHE staff come in as well, and we have resources available in terms of the Healthy Kids Colorado data. We've had presentations from the Office of Suicide Prevention, the prevention services, like, not to get excited about where I work, but I'm very excited about it. We have a lot of different programs talking about how we can increase protective factors in our communities. So more than happy to connect you with my coworkers.
Thank you, Bonnie. Megan?
That was a perfect lead-in. I was going to ask if it would also be possible to get information from other agencies who are working in this space. As we know, there's a lot happening pretty fast with the discussion around the RAISE, and those are the regional accountable entities, through HCPF, that is healthcare policy and finance. And are we going to be thinking as a group, as this group, about how those decision-making processes are going to be affecting just clients and providers and loved ones of people who are supporting, and kind of all of us, right? That is this group going to kind of be addressing that? And then will these just be informative discussions, or will we have a chance then to maybe give some input back to CDPHE or HCPF or the Behavioral Health Administration or other organizations that come to us to present the work that they're doing in this space? A little clarity there, since I'm brand new. Thank you.
If I can take that.
Sure.
Yes, I would love it to be that. I would love it to that. I mean, it's an informative piece about what is happening, and prior to launch of the initiative that would come to this council. And I think that would then allow for a timing piece of, hey, let's make sure that the Behavioral Health Planning and Advisory Council is informed on what is happening before it actually launches. And then the advisory capacity and the recommendations can then lead to some changes before things actually happen. That's how I would love to see an advisory council operate, which I think has been, I think we fell a little bit into the, hey, just an informative session about this is what is happening, right? And then there wasn't a whole lot of real opportunity to provide the recommendations and feedback to what those initiatives are. I would like, that's part of where if we shift it to a little bit different format, and then we really drive home the, hey, let's try to be a little bit more transparent to state government and have advisory councils see behind this magical curtain of state government, which isn't the magical curtain of state government, but right, we got to break down those barriers of what state government operates as well. And I think this is an opportunity to do that here. We good with that?
Yes.
As long as it gets executed that way, right? Like, and I think that's part of holding us accountable as well. Like, hey, we need more, we need something different. Like we need to have those conversations here.
And I have a question, Ryan. So the BHA, which is not this group, but are they still working off this 6 pillars of affordability, access, workforce and support, accountability, local and consumer guidance, and whole person care? Is that still intact?
Yes, and fantastic call out, because each one of the initiatives that we would present here should have a connection back to, because that's coming from the behavioral health task force and making sure that our behavioral health system is following those pillars and the recommendations from that task force that ultimately created the Behavioral Health Administration. I think our first step really should be is, who the heck is the Behavioral Health Administration and why were they created?
Mm-hmm. I think that would be a great starting point. Because, and of course, as grants go, I did a lot of reading grants, writing grants, and doing final grant reports. And they always want to know where everything's what category everything falls into. So I think it would be great for all of us to have a little bit of education on the BHA and those 6 pillars, and how then prevention, treatment, and recovery, those 3 areas fit within those 6 pillars. I think that would be great, at least for me, to understand.
So if I may, for the December meeting, can we go through the bylaws, the membership appointments, and then have the conversation about what is the behavioral health system in Colorado today? What do current state agencies, what are their roles? So when I bring up HCPF, healthcare policy and financing, what does that actually mean when we talk about that? That's our Medicaid agency. But then what does that actually mean? How many people do they serve, or what percentage of the population? Because I think that's a nice segue into what is the Behavioral Health Administration? What is the core duties and responsibilities of the Behavioral Health Administration? We do 3 things at the BHA, just as right? We're responsible for the big vision of behavioral health services in Colorado, but then we also regulate providers directly and we contract for services. So those are the 3 main things that the Behavioral Health Administration does. There's a lot of complexity into that, and a lot of, hey, what does that actually mean, Ryan? And if we can have that conversation there, also it goes into, how does that fit with the other state agencies? And I think that's a good foundational setting piece for, wait, why are you here? And why is this Ryan Templeton character with the BHA behind his name the one talking here? Right. And I think we can get into a good segue into bylaws from there about the creation of Bhpac is this for this reason, which hopefully then we can connect it to we're here for contracting, right? Block grant is a dollars that we need to get out the door to community to fill gaps. And so then we have that foundational piece that once we get to that, every 2 years, this council submits recommendations for how we spend block grant dollars, right? So then we set over this next 18 months or so, really the next year, I guess, to clear up that foundational piece of, hey, what is behavioral health in Colorado? Was it today? And what are we trying to have it be? Because I think those are a lot of the pieces and initiatives that we can bring prior to us formally launching those as the BHA as well.
Thank you, Ryan. Did you have a question?
This is Margie Grimsley, and
Mark,
yeah, I just Ryan, I didn't know if this is if people also need to be introduced to our unique role with SAMHSA and maybe having Charlie Smith. I know at one point he used to do that segment where he explained how we fit in with the SAMHSA and that work. It's important, I think, for people to understand our unique position, the council's unique position in alignment with that. And if it's not done in December, at least somewhere along the line, I think it needs to be included.
great.
Well, Margie, fantastic call out, especially with a bunch of new members. I mean, I think getting to know our regional coordinator from the Substance Abuse and Mental Health Services Administration, Charlie Smith. He works out of Denver and covers, I think, a 7 or 8 state area that he's responsible for what SAMHSA administration looks like within those states. So having Charlie come is always a very, very interesting. And then I will even offer up, we also have the ability to request technical assistance from SAMHSA specifically about how they and other states administer planning councils as well. So that's also another opportunity for us. I don't necessarily know what the technical assistance would entail. I think we can present to them about, hey, we're struggling with whatever. Can you provide some guidance for how other states have managed through this? I think that's probably what we could request of them. So be thinking about that too. I mean, I want to make sure that we are offering up as many resources that we can possibly have to be as successful as possible as a planning and advisory council here. And if that's pulling in our federal government partners, let's do it.
I guess I just remember when he would attend some of our membership meetings, he had also said there was a contact that was specifically for planning council. Maybe that is the TA guy, but it wouldn't hurt for us to connect with him as that person as well. Thanks.
I have a question. Are we still going to be involved in the legislature and monitoring legislation as it goes through?
If that's what y'all would like, we can provide those monthly updates about, I mean, we could potentially even pull a little bit. I think we had previously, or I previously provided this is what the legislature does over there. And there's just a few slides of that to get ready for the session that starts in January. And then also month by month, we would provide that. I think it was called a behavioral health dossier about what behavioral health related bills had been introduced, just so you have those in your hand if you wanted to look through the complexity of what's going on at that Golden Dome downtown Denver.
Well, I enjoyed it, but I don't think it's a priority. I think the council has more specified things to do, but I just wanted to know what to expect.
Thanks, Laureen. I appreciate that. Did you have anything to add to that, Ryan, before we move on to Boyd?
I see Megan's question about can we have the BHA policy team come to a meeting for Q&A? Yes, Andrea, the deputy policy director, is usually here. She's on vacation this week. And then we could have Casey come, our legislative affairs officer as well, just so you can put a face to a name. And Casey is our BHA staff that is at the Capitol, what feels like 24/7 for those first 120 days of a calendar year, which she is there every day and night, what it feels like sometimes when they work in committee until all hours of the morning. So getting to know Casey, I think, is a fantastic opportunity for this group as well.
Great. Boyd, did you have something? I think you're muted.
Let's try that again. Okay, Ryan, I do have the name and phone number of that technical assistance person. Membership committee got some of that information from Charlie earlier in the year. Charlie does such a good job of coming in and explaining what SAMHSA is and our purpose. So I think that's great. One of the things that, especially, well, I'm going to say for all of our new council members, but this is also for those that have joined us in the last year or two, is that membership is got to get on top of doing our membership orientation. And I don't think that will be ready by December, Ryan, but maybe we can do that in January. And within that membership orientation, we have previously discussed that actually it would be good for all members to go through that probably on a yearly basis, if we're still on track with that. And then kind of within this, because it also fits into the bylaws, is that we have our categories of that we assign people into, such as the 51% that this council must have of people with lived experience. And for our new members, what's a little bit different with our council is our council is mandated in federal statute, unlike other state councils and committees. So, but within that is, for example, the family members, is that over the almost 9 years I've been on council with extensions because of COVID, et cetera, is we have tracked, that we have people that are family members on council, but we haven't tracked that a person, as we've heard some people speak today, might be here as a family member, but they also have their own experience, with their own substance abuse or mental health concerns as well. So those are some little bits and pieces that the membership committee is going to be working on over the next month or two to make sure we got that data for a demographic, so that when we are communicating with SAMHSA, that we can show that a family member also that people fit in these other categories as well, though they're primarily here as a family member. But also for our new members, sometimes that breaks down further, such as with an example with the people in substance abuse recovery is, are they a youth? Are they a young adult? And with the family members, it's especially, is it a young child? Is it a teen? There are some of those various categories that we really need to get a better handle on what the members on our council represent, so that when SAMHSA has some things that they really want us to adhere to with some specific people on council, that we can be sure that we have folks on council, or that we are recruiting them, and that we have that demographic information. So.
May I ask a question? This is Megan. I'm sorry, I didn't raise my hand. Lloyd.
Go ahead, Megan.
So you want us to just contact you so that you can narrow down like which seat we fit in, or how do you want to collect that?
So the membership committee has a lot of information, especially with our newer members, because the application for our new members was more extensive. So we will actually reach out to each member and confirm, talk with you about which category you're representing on council, and any other information we may need to get that, losing words this morning, to get all those bits and pieces of the background of people on council. And so we'll reach out to you.
Thank you.
Thanks, Lloyd. Thanks, Megan. I was going to ask a quick question, Ryan, and I muted myself. Since other states are likely in the same situation we are there bylaws that they're using that you guys have looked at as examples of how their advisory committees working for this funding?
Yes, we had previously looked at other bylaws. Some advisory councils meet 2 times a year, right? Like, so there's a whole wide range in what the administration of advisory councils looks like across states. Yeah, this is a fun one when Charlie Smith comes in, where he's like, oh wow, like Colorado is really seen as a very, very high functioning like leader of how of Bhpac, which is fantastic, right? It just shows the engagement and the people that are willing to have these conversations. And really, I think this is a real fantastic opportunity to address stigma related to, right, having these conversations and open with these conversations. But yes, we can pull those again, even with that. I see, Dennis, your background and your hand are very similar in color.
Oh, is that what's happening? I'm so sorry, Dennis.
Not a problem, not a problem. As far as bylaws go, the one thing I'm impressed with our current bylaws is the flexibility that's been written into them, which to me is quite unique in the way we operate. Just to give our members a little background, Lloyd and Margie, as co-chairs of membership, both got termed at the same time. And they came to me and said, would you be co-chair? And after, I wiped all the perspiration off my forehead because I'm new to this as well. I said, boy, I'm more than happy to do that, but I just don't have the experience in how this is functioning. Well, Lloyd went and did a lot of clarifying from the bylaws. And it turns out that you do not have to be a member to be on a committee or a co-chair. So I said, okay, here's my condition, Lloyd. You need to be a volunteer co-chair for membership so that you can guide me. Margie, of course, is also the co-chair in prevention, which I'm on that committee as well. And I'm very interested in her staying involved in that and moving it forward. We really need to have people like Lloyd and Margie with their experience on the council to help guide us and point us in the right direction, because they've kind of seen it all over the 6 and 9 years they've been involved. So that to me is very important to keep in the bylaws. The other interesting thing is once you come off after 2 3-year terms, after 1 year, you can reapply. And again, I'm interested in quality rather than quantity. I want people with passion to stay involved and stay active. So a year from now, Margie and Lloyd can reapply and join the council again as voting members. And that to me, that kind of flexibility, I think, is crucial. And I also am very interested. I had a great conversation with Dr. Rosen about his passion as a psychiatrist and a teacher, professor of mental health, about innovation, and to look at prevention and have a subcommittee of innovation. or have prevention and innovation combined in some way, shape, or form. We would really, I would love to see things expanded. Our prevention committee, to me, was a bit skimpy. We had hard workers. We had Margie and Lorene and Bonnie and I thought we knocked out a lot of work, but prevention, I think, is pretty crucial. And one of the things that SAMHSA was moving in the direction of is including mental health more directly in prevention rather than just substance abuse. And that is reflected in our recommendations on how to use funding for prevention, and also to incorporate prevention in all the other committees, because it's part of treatment, it's part of recovery. So again, I'm very excited about rewriting the bylaws. But again, I want to keep the very best part of what we already have and then expand from there. Thanks.
Thanks, Dennis. Sharon, you put a message in the chat. Would you like to expound upon that?
No, it just took me forever to finish. I was back to when Ryan was talking about how often we meet and looking at other people's bylaws. And I thought twice a year, you're looking for a check mark. But I like the fact that we want to meet and we want to work. That's what it's about. We're not a check. I'm not a check mark person. I'm come to work and I want things to happen. So I was just trying to cheer on what Ryan said, but it takes me forever to get done because I get sidetracked listening.
I appreciate that, Sharon. Thank you. And I completely agree with Sharon, and I'm wondering what the rest of everyone feels like. But I feel like monthly, we're in such a crisis that I wouldn't dream of meeting less than that personally. And I'm hopeful the rest of the group feels that way as well. So far we've talked about next meeting, getting information on the bylaws that you used as examples before, and kind of an overview of BHA as it is today, how it got going, Ryan, and potentially having a SAMHSA representative, specifically Charlie Smith, and maybe even legislation updates of what's coming down the pike, maybe just a quick bullet point. And then again, ensuring that we have very specific demographic data that Lloyd brought up, but I guess they're going to take those phone calls. But in the meantime, if we had an update on that on our December meeting, what they got from that survey on the phone. And then we did have a request to receive documents at least 72 hours prior to the meeting. So folks that have different abilities are able to get through that information and process that prior to the meeting. So if that's an option, that would be fantastic. Does anybody have anything to add to that thus far?
Well, I don't know how do you raise your hand here? Oh, just like this. Okay. I don't know if this is the right time to bring this up, but what Dennis and I had some conversations prior to this meeting, and if this is an interest to this advisory board, there is virtually no research nationwide in service delivery of mental health service delivery within the community systems. That's because all of the research money goes to academicians at universities who aren't part of the community mental health. And as part of maybe the could this be in the bylaws? And Dennis had talked about an innovation committee or an innovation that we don't know what is going on elsewhere in the country that is creative, innovative, effective. And if there was a way to either through a some kind of communication mechanism or meetings or whatever, get similar states' impression, how are they solving the problems that we're struggling with? So I know Sam, so, you know, does that make sense to people? What we're struggling with, everyone else is struggling with. Do they know things, or have they found things that we're yet to think of?
Brian, do you want to speak to that?
No, Dr. Rosen, I appreciate that. I mean, I think that is also, like, to me, we can tie it even back into some of the responsibilities that the Behavioral Health Administration specifically has about how do we actually monitor the system that it is actually working, or how are we even establishing some level of outcome response, so then we can clearly identify that, hey, things are moving in the right direction. We have that as one of our key initiatives that we are currently in the process of creating, just even simple one-pagers with talking points on. That's what I'd love to get to with this council, is like, before we launch those things and say, hey, when we talk about a performance monitoring system, what does it actually mean, and what is the meaning and the outcome from a council like this that can provide your all's input into what would that system look like for you all to have, to know that, hey, the state is looking to support the services that I as an individual need, or my community needs. I think that's the power of a group like this. And Dr. Rosen, I think that goes very similar into what you're talking about. Is like, how do we ensure that this is happening? Right? And how are we measuring things that actually make sense, rather than just the measuring money in and measuring money out? How are we actually getting some quality from that? So I appreciate that.
Did you have a question, Dennis? All right, so at this point, Ryan, I'm not sure. So we want to add potentially some kind of outcomes conversation. And I don't know if that's in December meeting. We're kind of filling up for December's meeting.
Yeah, I think we probably have a pretty full December already. But I think this is also an opportunity that I think every single one of our council meetings needs to have a conversation about, what do the upcoming meetings look like and what should they be? Just like we're having now. I'll also throw out there, we meet monthly. We had previously been meeting from 9 to 12, which is a lot of time. Do we want to think about, should this be 9 to 11 is more of a standard, like, hey, let's get to that spot of, hey, 2 hours together. Let's make sure that because it feels like once we start hitting that third hour, it feels like we maybe get a little bit, I've been here a long time, right? Do we want to try to make sure that our agenda items are a little more condensed, in, like, let's get it to 2 hours and go from that way?
Lloyd, go ahead.
Yeah, I think that would be awesome, Ryan. And then if we get to the point where we have committees meeting again, that will be that third hour being normal beforehand.
Maureen?
I'm sorry, I talked before I was permitted to do so. I would appreciate that too. I find it difficult the third hour. And when we have a break, it's not so difficult, but I really have trouble neurologically going for 3 hours straight. And the committee time would be wonderful. It would be switching the manner in which information is being presented, and I think I could handle that pretty well.
Thanks, Maureen. Anybody else have a thought on moving it to a 2 hour window instead of 3? Annette?
I think 2 hours would be great. And I think I've been, attending for a bit. I'm a relatively new member, but I also think that there's just some ways that I've been in other groups and meetings where we tighten it up just a little bit. Just even so simple as putting introductions. We all kind of get to know each other pretty fast here and know each other's names and stuff. And so maybe we could use chat for our introductions to put who's available. And then that, like, I know we spend about a half an hour on introductions. So we can really get to the meat of the work that we're doing and not spend so much time, and maybe just doing updates on if anybody has, significant updates that they want to share with the group, then they could have the floor for, maybe we could cut that down to 10, 15 minutes rather.
Thanks, Annette. I agree with that. And Shannon, did you have a comment?
No, I was just giving a thumbs up.
Oh, a thumbs up. Excellent. Fantastic. Yep. So how about a thumbs up or a thumbs down from everybody if you like the new 2 hour? Thumbs up. I'm seeing thumbs up. Okay. We're going to go with the thumbs up voting mechanism for this one. How about that, Ryan? So I think that's pretty overwhelming. Everybody is in favor of the 2 hour window, 9 to 11 a.m.
Yeah, I appreciate it. One more thing for the December, I would love to put on like a council business agenda item where we talk about what minutes are and what they look like and voting for those, as well as having that next level conversation about what chair, vice chair, or co-chairs. It feels like that's kind of goes into our bylaws discussion as well. But I think we're kind of quickly running into Aaron is doing a fantastic job, by the way, as running this meeting. Shameless plug there. But it's also one of those ones where, like, yeah, I think this is our real opportunity to get to that spot of what's the most comfortable for us as a council to get our stuff done, like hear from things and really submit those recommendations and, dare I say, hold the state accountable for what behavioral health services look like in this state, right? Like, that's why we're here, right? Like, that's why I work for the BHA. I want to be held accountable for the services that my kids need, right? Whether they need it now or need it in the future. Like, I think that's, as long as we're working towards that same thing, I think we can have tough conversations and put it in a 2 hour chunk, come here fully engaged. And I think that, I love this approach. Yeah, every time I meet with Bhpac, I get more and more excited. So I will stop myself there and just say that I appreciate all of you, and I'm excited to continue to work through this with y'all.
Fantastic. Who currently does write minutes, Ryan?
Donda.
Okay, fantastic. And then, so are those sent out post meeting or with the next meeting's agenda?
Yep, they're normally sent out with the next meeting agenda. I think we can commit to a week prior. So the Thursday before this Thursday meeting is that we'll have agenda, minutes, and the content or initiatives or things that we'll be going over as a week prior, submitted to council members as well as posted on our BHAC website. I'm working with our communications team to make sure that our website is actually accurate, because then that's also the next level of ensuring that we have the right names, have the right pronouns when we place names on that council website as well. I don't necessarily think we need to go down the path of like whole descriptions of who each of us are, unless you want to go down that path, but we can have that conversation about, do you want that stuff or that information on the website? But I think that's a conversation for maybe a month or two from now, related to what membership and identification of membership looks like, because I think we got some behind the scenes work to do related to appointments, how long you're serving for, when does your term run out, are you still a member, are you not a member, are you eligible for a second term? We got a lot of work to do at the BHA, right, about related to how all of this works, because ultimately it is the BHA's responsibility to ensure that this council is is there, is active, it's running, and y'all's time is valuable. And that if we are going to ask of this, let's have you participate in a way that makes sense for you as well as for the people of Colorado that we're influencing here.
Excellent. There was a message about a third hour for committees. So I'm wondering if those get going, I guess we can bring that discussion up as far as adding additional time when we get committees going in their work to have a committee report. Does that make sense, Ryan?
I would say it could even be do we keep the 3-hour block on the calendars with the expectation is that it's a 2-hour meeting?
I'm okay with that. Does anybody have discussion or comment on that?
Ryan, yes.
Yes.
Great. Shannon, do you have something?
Yeah, I had just put that in the chat more from the standpoint of I feel like where maybe the committee meetings had kind of lessened since I was first on BPAC. I thought if we move to this 2 hours, that's a good opportunity because people are used to having that 3-hour block of time, that maybe that would be a way to encourage those committees to go back to meeting or maybe to be able to have better attendance at their meeting. I know just from the recovery group, when we're trying to schedule a separate meeting outside of this one, it's hard to get everyone, on another same day and time. So that was why I was putting that out there.
Okay, great. Thank you, Shannon. Sharon?
I love Shannon's idea because that's a great time to use that. I think my only issue with 2 hours is that we don't overload, and I think I put that in the chat, not to overload our meeting enough so that we don't have time to really study what's in front of us. And as long as we do that, I think it's a great idea I love Ryan's idea. Let's just plan on 3, and if we are done in 2, we're done. And that leaves room for that extra time for discussion, and it also leaves room for our committees, and it solves all the issues. We'll just be done if we're done.
Thanks, Sharon. Megan?
Yes, thank you. So just to reiterate, getting those documents, whether it's a presentation from an external organization, the minutes, anything that you would like us to review in advance, making sure that we do have enough time. And I know that could be cumbersome if you have a different organization coming in, but it's also an accommodation for people with traumatic brain injuries or cognitive challenges. So I would request that at least it comes 72 hours in advance at the latest as an accommodation. And thank you for providing those materials so that we are up to speed before the meeting starts. Thank you.
Fantastic. Thanks, Megan. I have a question, Ryan. So up to this point, have there been any Spanish speaking folks in our community that have applied or wanted to serve? Do we have a language justice interpreter option available to this group?
That is a fantastic question, and I need to do some homework because we should absolutely have. I mean, ASL as well.
I think we did have a member or two who spoke Spanish in addition to English, but I don't remember who they were.
Thanks, Lauren. The advisory council I serve on with Summit Stone, we have a member that's solely Spanish speaking, and so they contract with an interpretation service. And so when we're all on Zoom, she's receiving the interpretation and can actively engage with our group. And that subsection, I'll tell you, that's who we're seeing our Hispanic population. We're seeing numbers with them rising for prescription drug abuse and overdose. And so we really need to be able to have that community have access to this as well. So I'm just throwing that out there, Ryan. Megan, did you have something?
Just Rising Up the Community Language Cooperative out of Denver, and they oftentimes will do live simultaneous interpretation for these kind of events. My cat agrees. And also happy to assist in helping to bring on some Spanish speakers, both in rural and urban, if that is a need. I'm happy to assist there. We have a bilingual advocate within the Colorado Cross Disability Coalition. We also work with Ute Mountain Ute, so just kind of a little nudge towards including our Indigenous populations as well.
Absolutely. If you could share that contact information with Ryan, that would be fantastic, Megan.
Of course.
And then, of course, if we do that at some point, all of the attachments would need to be an agenda, and everything would need to be translated in Spanish as well. If we get some members on board.
Erin?
Yes, ma'am.
Who would be the audience then for that? Who are we speaking to? Because generally speaking, I don't think we speak to the public at large or brings material from the meetings. So I would see a good idea would be maybe to offer this material to associations, professional groups, to let them know what we're doing. But I'm curious about who the audience is.
I think it's about getting this group as diverse as possible, and so all voices and demographics are represented. And so I feel like if we can't open this group up to solely Spanish speakers if we don't have that set up for them to be able to access that.
Okay,
so
I see.
That's what I'm looking for, is to make sure that this group is accessible for anyone to represent their demographic, which right now I'm not seeing. We might have Spanish speakers, but there are folks that are living within our community accessing our behavioral health care services that are just Spanish speaking families. And I think, and that's a huge population, at least in Larimer County. So.
Okay, that makes sense to me.
Okay, anybody? Bonnie, did you have something?
Oh, I just wanted to give all these fresh faces kudos because I've been providing TA for this group for 4 years, and I think the equity discussion has always been robust, and I really like how y'all are already operationalizing inclusivity and thinking about the how do we do this. So kudos there.
Thanks, Bonnie. I appreciate that. I'm just kind of reading the chat. Charles, thanks for being here. You're you're taking off for the day. I guess I'm the proxy vote in case we vote on anything else from there. Does anybody have anything to add at this point? I haven't heard from some folks. Tasha, Stephanie, Carla, Laura, I haven't heard much from you guys. If you want to pipe in with anything, you're welcome. No. Bonnie, is your hand still up, or was it just left up?
Did not lower it, so let me put
okay, great. All right, Ryan, where are we at?
Over the last few months, we've kind of closed out with updates related to prevention, treatment, and recovery. I mean, we can have that conversation, but do we keep that on as agenda items? Is this I mean, I think it's always to me, been very powerful about, hey, what's going on within your organizations, within what you all are interested in. Allows for a next level of connection too. If we want to do that now, I know we're at 10:57, but also we had a 3-hour block. So if we want to go there, is kind of our last agenda item before closing. Erin, are you on mute?
Yes, I was. Sorry. I was just thinking, and or to your point, if we have members from the current committees from this group, if they want to give a shout out on where they were at with their committee work, I'd be happy to hear that too.
So I guess I think this is an interesting piece, is that where our committees, I don't know if they've been formally meeting since we've submitted the recommendations for the block grant. So I think there is that level of, okay, I think there's the conversation about, and it fits into bylaws as well, what does community or committee timing look like? Kind of reiterating that committees really are there working for the whole of Bhpac, and then that's also the opportunity for us to have robust conversations about what sort of committees do we need moving forward, and especially making sure that committees are fully aware about what the expectations and what the deliverable back to Bhpac from a committee that is created, which I think is a powerful conversation to have in the future as well, related to kind of the administration of this council.
Fantastic. I don't know if it was Bonnie or Margie first, or was it Shannon? Margie, go ahead.
I just wanted to share from the prevention committee. I think and I don't want to speak for our group totally, but we put a lot of work into our prevention recommendations, and I think it really will be important to continue that conversation as a committee. So having that third hour to be able to do our committee work, to me, would be a great idea. But it's also maybe the question for Ryan. I think I've asked it before. When we put in the recommendations, I think our hope was that we could continue looking at how to take action to accomplish the recommendations that we brought forward. And so is that still something that the committee work can be doing, is to go in more depth with the recommendations that we made? Because I hope we didn't just make the recommendations to then to go into a black hole and not really have a part of how they're implemented and what happens with them.
Yeah, I mean, I appreciate that, Margie. I think there's the piece where the work of the committees submitted the recommendations to the council as a whole, which then the council of the whole voted on and submitted those as the recommendations for inclusion in the block grant. So I think there is that next level of what does reporting back and holding the BHA accountable to the recommendations and where they were and how are they included in the block grant application. And then I think that does lend a level of, okay, even thinking about what initiatives or what sort of presentations come to the council, also thinking about how that relates to potentially continued review and continued addressing what those recommendations were, and how do we get to the spot to make sure that those things are being implemented, and doesn't necessarily just have to be a block grant, right? So I think that is a powerful piece to make sure that it isn't just a check the boxes that recommendations were submitted and part of the block grant application, but also like this is the opportunity for us to really work towards how do we drive change here, right? Through an advisory council body, right? It is about recommendations, but then it's also about ensuring that those things are moving forward. So I think that to me is the foundation of what we should be doing over these next few months, is making sure that we are all clear about what our role is here and making sure that we are driving towards that shared goal and vision of what behavioral health in Colorado should and could be. Right. So, yeah, I appreciate all of those calls out, because I think that's where we have to make sure that things aren't connected. And I don't ever want this to feel like it is just a check box and we need this to get block grant dollars, because it's not a service to each one of you that put a whole bunch of time and effort into this. So, yeah, and if it feels like that's happening, I want to make sure that we have the opportunity to be honest and frank with each other, even in a meeting like this.
Fantastic. Thank you. I appreciate that, Ryan. So are all of the departments, divisions that everybody partners with, and part of the folks that are online today, are they aware that there's an advisory group that's willing to look over any of their proposed initiatives or programs or that they know that we exist and that they can come to you to say, hey, when can we be fit into an agenda item to go over this and get some feedback from your group?
That's a fantastic question, because I think it's also a question that goes to our other advisory council as well, BHAC, about, I mean, I think there's an opportunity to really drive home that this should be a requirement when you're creating new behavioral health programs, is that it comes here at the beginning. As people get to know me better, I have no problem asking for those things, right? Hey, I'm here to make some waves. So until I'm told otherwise, let's continue to push it. So right. I haven't been told otherwise yet, so let's continue to push it as well. So
great. Well, I didn't mention in my introduction, so I'll take a personal point of privilege here quickly. Housing is my number one issue. Housing, and security. Because I've seen it within my own family and group of folks that experience behavioral health issues, specifically co-occurring diagnoses, and with affordable, accessible, supportive housing, I imagine our recovery rate would look very different. And that's what I see the biggest gap in my community is housing security, supportive, transitional housing. And so, yeah, without housing stability, I think it's, and we can ask the folks with lived experience that have been unhoused and have had those co-occurring diagnoses, how that affects them and if they're seeing that as a large gap. But that will be one of my number one focus on this council. Sean, did you have anything to add, or Lou?
No, I would agree with that. I think Samsa's pretty spot on when it says that there's 4 pillars that support recovery, and that's home, health, purpose, and community. And I see all 4 of those. For me, community and home were just, recovery wasn't possible without those things. So
thank you.
Yeah, I agree with that too. I think housing is going to increase the recovery rate exponentially. I've suffered with that in the past and kind of still am. So yeah, I'm excited to be a part of that. I think it's a great idea.
Fantastic. Megan?
Just rising up the comment in the chat around communicating the opportunity to come to this group and share. And as Ryan said, let's do it, right? So can we really let's do it? Like, can we put out a press release or some sort of a statement that says, hey, you are welcome to, and maybe even you should come and do the it, right? So I don't know, Ryan, if that goes over the line or if we're able to have some sort of
succinct communication around this ability, what that looks like, you know, a process for this that we can share out.
Again, I love this approach. I think the first step for us is setting up what that process does look like. And if we are seeking to get and put stuff out to say, hey, I mean, I would even potentially consider using strong language like yes, we are here to support your initiative. So the expectation is for you to come here before those things are launched. The thing is, I think we just have to have our policies and procedures pretty tight with how people do get on our, which hopefully becomes honestly a waiting list to come to Bhpac and make sure that there are initiatives, and then how we prioritize those things as well. So I love this, and I think this is really the opportunity to really push what should we be hearing here, and then if we're not hearing these things, why aren't we hearing these things, and then allows that next opportunity to. Is that just a massive gap within our system because we haven't heard about it or it's not happening? And then how do we actually drive a change, which then I think flows directly into, is that not what our block grant dollars should be used for then? Because we've identified a gap because we have never heard of these things or they're just not here, which I think that flows into a large piece of one of the three core duties of this is blocking our recommendations, but it's also advocacy as well as knowing about what the behavioral health system is. So then I think it ties together even nicely with what the federal government said needed to happen within an advisory council. It's not just to check the box that you need to have this. So
Marjorie?
I think too, this is by having them come, and this could be a way to intertwine our recommendations, because I'm not sure they would necessarily have heard our recommendations, but by inviting someone in and emphasizing how are they helping to accomplish what our recommendations are and include it in their work. I'm thinking about, I know from prevention, our goal was number one is even defining what prevention is, because so many different departments talk about prevention and don't really, what's our common language and even expectation or understanding of what that means. So it's not just learning from them, but also them learning our priorities as well.
That's a great point, Marjorie. You know, at this stage, Ryan, I either need a break. Does anybody need a break for if we're going to continue the meeting? I would need like a little 5-minute break, probably.
I mean, there really wasn't any other agenda items or any things that I had informally written down about getting accomplished here today. So I will throw that to you, Aaron, and the group as a whole about, do we want to go forth? I think we've talked about what is for December as well. So we will do the background piece and make sure that we have agendas out, content to you all before a week prior to our next meeting, which I think is scheduled for, let me double check really fast here, December 7th. And then kind of go with that as kind of our next level of, hey, getting into the nitty gritty of what this we can do here.
Perfect.
And ultimately should be doing here.
Perfect. I do have one request. Is it possible for you to share a list of our contact information with each other? So if somebody wants to get in touch with Lloyd or anybody, Marjorie, if that's okay with everyone, if we give our consent for to share contact information, I think that would be fantastic for us as a group.
Donda, can you put even if it's a BCC to the council members that we have with my contact information, your contact information, and the BHA staff that routinely attends, essentially just with a, hey, if you're comfortable with this, and you're good with being on a kind of a Bhpac distribution list, then we can go that way as start that off, which I think is a good segue into the making sure that we have the right contact information for getting meeting invitations sent out, as well as the the minutes, agendas, and content. Because I don't want to flood emails and inboxes if you don't want that and don't agree to it as well. But that should be part of the agreement of being a council member. But I don't know if we've been explicit about that yet. So don't want
to. Brian, we have shared out part of the membership roster to our council members as a whole in the past, but I need to update what membership has with our current new members and reviewing a couple of our past members that may be removed from the roster. So membership should have that done in the next few, I don't want to say a few days, but within the next week. And I can get that to Donda.
Excellent. Donda, do you need anything specific from any of us?
No, what I may do is the same thing we did last time, Ryan and Lloyd, and send out the hey, give us your contact info, what areas you work or you represent, and things like that. Maybe you and Lloyd, can work on that, and we can send that out to everybody, and that way we can see who wants it published and who doesn't.
Right. And I think that could help with some of that demographic information that Lloyd was looking for with his membership committee versus, to lived experience members versus providers. And then maybe have the subsections with lived experience, whether it's yourself, family member, and if that falls into the youth or what, I think we could give him some of that demographic data he was looking for too.
We could probably use Google Forms again, Donda.
Great. That's all I have, Ryan. Does anybody have anything else?
Well done, Miss Erin.
Thank you. I'm glad I brushed my hair this morning. I appreciate that, Lori. So if there's nothing else, I would move to adjourn the meeting.
Second.
All in favor?
Aye.
Aye.
Fantastic. It was so great meeting all of you. I almost was in tears. Just, I love knowing I'm never alone. There's a lot of us. So thanks for being here, everybody.
Okay.
Thank you.
Thank you. Have a great day.
Thank you, everyone.